Today, I'd like to talk a little bit about the arthritic knee and some ways that physiotherapy and rehabilitation can be really helpful in terms of coping with this condition. But before I continue, hi, my name is Eric Hammer, registered physiotherapist and owner of Home Comfort Physiotherapy. And my purpose and passion is helping those from the comfort of their own home regain their functional capabilities and get back to the activities that they truly love. So essentially, with an arthritic knee, what happens over time is between our tibia and our femur, we have cartilage, and over time, what happens is there's wear and tear that takes place from this cartilage, and over a period of time, because of this wear and tear, we'll eventually get bone on bone that takes place, and this is essentially what arthritis is, and osteoarthritis in particular. That's the condition I'm talking about here. And so, with this bone on bone comes several different symptoms. So, what patients will perhaps experience will be swelling, will be pain, will be a reduction in terms of mobility within the knee. As a result of this, the patient might have a bit of a limp. There might be certain periods of time where they feel a little bit more painful or stiff. So, for example, first thing in the morning, or for some patients, they'll describe changes with weather conditions. And again, as a result of this, it can be quite painful, specifically with regards to impact type of activities. Again, this could be walking, this could be stairs, this could be things like going from a sitting to standing position with limitations. So some of the things that we would want to do in terms of from a physiotherapy standpoint is number one is mobility. So through hands-on treatment perhaps, or for some individuals, biasing a specific direction in terms of range of motion and mobility can help to regain overall range of motion and mobility within the knee. The other thing to keep in mind too with this is trying to build up the strength of all the muscles that help to support the knee, so muscles that cross the knee joint, as well as other stability type muscles. So, for example, pelvic stability muscles, in order to help with our walking pattern or help with other kind of functional uh, activities, such as going up and down stairs, again, sit to stand, squatting, these type of things. The other thing that can really be helpful too is the type of surface, right, that people are walking on. So again, typically impact type activities are going to provoke more pain for the individual, and so whether it's footwear, softer cushion type of footwear can be helpful, or the surfaces they're actually walking on can be helpful in terms of reducing the impact on the joint. So also for some individuals, something as simple as doing aquafit, going in the water, can really be helpful in terms of offloading the joint with the buoyancy of the water. And so, again, from a physiotherapy standpoint, these would be all the conservative treatments that we might want to look into when it comes to somebody who's suffering from an arthritic knee. If you have any questions or concerns, feel free to leave a comment below. And if you're an individual who requires some form of in-home rehabilitation help, you might be struggling with a knee that, again, is impacting your ability to do the activities you want to do, feel free to reach out. I have my contact information below. And please check with a doctor or physiotherapist to make sure this or any other information is appropriate for you. Thanks again for watching, and have a great day. Take care.